All right, this is my presentation on trauma and ASD. I'm going to try to make it all the way through with my computer working. We'll see. What is trauma? So the definition I've provided here can kind of just get us jump started. It's from the Trauma and Justice Strategic Initiative. It highlights trauma as a result from an event, a series of events that is emotionally harmful and threatening and has lasting impacts on an individual's functioning. Um, I like this definition because it broadens the scope of how we're defining trauma. It's not just kind of the more exclusive diagnostic criteria that we talk about often in class, and is more so a broadened subjective perception of what's impacting an individual, which will be helpful, as we'll see here in a second. What is autism spectrum disorder, or ASD? So kind of defining what we're working with here. It really depends, the language we use for autism spectrum disorder really depends on the lens we're using and the framework. Um, that's kind of beyond what we're talking about here, but are we looking at it more as a deficit, as a disability, as differences? That kind of depends. Again, in the literature, it does as well. But autism spectrum disorder itself is characterized by social communication differences or deficits, restricted or repetitive patterns of behavior and interest, and hyper and hyporeactivity to sensory input. I would add to that list as well. Um, yeah, it's often characterized by not only these things, but also um, experiences with GI issues. So kind of like more physical somatic issues, um, which impacts mental health as well. There's lots of comorbidities as we'll talk about, but those are some of the highlights there. Um, so ASD is a very unique trauma picture, as are all trauma pictures. And by that, I mean that there's a lot of heterogeneity that we're working with. Autism spectrum disorder itself is often thought of as kind of this one clump, and everybody's kind of the same, and that's just really not true. So there's a lot of heterogeneity for autism spectrum disorder as far as how symptoms manifest themselves. There also is a lot of heterogeneity for PTSD and how that presents itself. And just to add to that, there's going to be a lot of difference between a child with ASD or PTSD or both and an adult who's experiencing those things. And so it's important to come into this conversation, especially for an underserved and under-researched population with, yeah, a lot of humility about a lot of the differences that we're going to see and similarities too. So some of the themes we see across the literature. I'm going to kind of run through these pretty quick, but overall, greater exposure to particular traumatic events, so direct traumas, as we would define them, of like social victimization and bullying. Those can be, again, like life-threatening things that would fit into like a PTSD criteria, as well as vulnerability to neglect, maltreatment, and abuse from caregivers, from support professionals. Um, and so those things are just a greater exposure that makes traumatic events more potentially, um, yeah, there's greater exposure, all that to say. In addition to that, individuals with ASD often have fewer internal and external resources to cope with traumatic experiences. So there's less social support because of some of the social differences and interpersonal difficulties for individuals with autism. Emotion dysregulation. A lot of individuals with autism, because their sympathetic nervous system's just going 24/7 and they're hyper aroused or hypo-aroused, under-aroused is what that would mean. Um, their emotions are kind of out of whack often, and that can be irritation, agitation, and just make traumatic experiences more difficult, as well as comorbidities, especially anxiety, ADHD. One of the things we're going to land on is difference in perception of traumatic experiences This Haruvi Lambden et al. Study is used a lot throughout the literature, as is a 2018 one. This is kind of highlighting how for hyperarousal, the things that made ASD individuals versus typical adults in this study hyperaroused differ dramatically. For typical adults, the criterion A for PTSD of life-threatening things and direct experience or vicarious experience of those things really does well to fit that population, as this shows that 0.52 statistically significant. For autistic individuals, negative social events, kind of what we just talked about before, as well as experiencing themselves as less than their peers or different, those were traumatic experiences for them. So overall, the total number of events was similar or the same, but there was a difference in what was experienced as traumatic. What that highlights is we need new categories to kind of think about this. For individuals with autism who have memory differences, who have local versus global thinking, as in very detailed thinking versus making sense of things in narrative and as a global big picture, often described as population. ASD individuals are often ruminators, again, hyper and hyposensitivity to sensory input, and often inflexible as far as mental schema. Um, and so that just is part of what makes it difficult for these individuals as far as making sense of what is traumatic, whether it's direct experiences or more social perceptive experiences. And thinking about it in terms of complex PTSD, as was highlighted in the 1990s, um, thinking of traumatic experiences more as cumulative and adding up over time and self-identity impacting because it's an everyday experience and it's impacting how individuals might be viewing themselves is a really good way to enter this conversation versus just a one-time trauma or, again, a very narrow view of what that is. For caregivers, unique trauma pictures also, again, like are going to show themselves as unique vicarious trauma for caregivers. And so being attentive to the fact that people caring for individuals with autism, whether that's children or adults, um, they report a lot of parenting related distress or caregiver distress, and a lack of social support for themselves. And so that makes them developing PTSD symptoms or just stress symptoms in general, and burnout increase a lot. Overall, I was a little bit discouraged because I found a lot on abuse and I found a lot on supporting individuals with autism versus um, more of a picture on like what would it be to care for people who are caring for people with autism. Again, whether that's adults or children. So I'd love to see more in terms of that in the future. As far as strategic ways to intervene, trauma care focusing on peripheral ASD symptoms versus core. So just highlighting the fact that when we're intervening for traumatic experiences, it matters that we're focusing on the right things. So not just looking at the things I highlighted earlier as far as ASD symptoms, but the core symptoms, excuse me, but the peripheral symptoms of ADHD, PTSD, that rumination, those things, if we're looking at traumatic experiences, matter as priorities. Um, yeah, intervening at emotion dysregulation. And so waiting for individuals to be emotionally regulated before we're kind of working with them in different ways. Trauma-focused CBT adaptations. So it's really important to get caregivers involved. And it's important to have proper emotion regulation that fits the population. And so there's a lot of adaptations that would need to be involved for that model of CBT. I'm running out of time here. Play therapy itself was not found to be super sufficient for this population because of some of the memory differences and how play presents itself too. Um, and then overall, I'm running out of time again, but research implications, we need a broader understanding of trauma for neurodivergent experiences. Um, the big thing to highlight is ASD vulnerability to PTSD. So does having ASD make somebody more vulnerable to traumatic experiences themselves, or is there a shared mechanism for ASD and PTSD? So the nervous system being hyper aroused, is that like a baseline experience for ASD individuals that just inherently makes them experience life in traumatic ways? It's interesting to look at. So yeah, as a quick run through, that is my presentation. So